So see, maybe 10 mm like that or 14 mm.
So it would be.
Yeah, your face will get a little longer.
Okay.
Then only it will suit.
Okay.
Because see, otherwise your length of the face and things will not match. 14 mm is about this much.
Right. Okay.
10 to 14 mm is a maximum we can do without doing bone grafting.
Okay.
And so I think we should do the maximum, close about near to maximum for you.
But then would it be like pointy? Because I don't.
No, it's not going to be pointy. I'm not talking about this. This will remain.
Right.
But we can bring it forwards and downwards.
Okay.
So the distance between your lip and the chin now is like, let's say 1 inch. That's going to become maybe 1.5 inches.
Inch and a half. Okay. Yeah.
14 mm more.
Yeah.
That's the point.
Yeah.
So then the proportion will become better.
Okay.
And when I do work on the back, then that will go inside, and then you have overall very nice improvement.
Right. Okay. So there will be those plates and screws.
Yes, surely.
They'll all.
Yes.
go in.
At least 2 plates and 4 screws minimum.
Okay.
I think that will be enough.
So over time, do they?
Once
same
once they heal, they're good to stay for life. We use titanium medical German grade
Right.
plates and screws.
Okay.
We are not putting a lot of them. In some patients, we even put 8 plates and like 32 screws. When the when the quantity of the plates and screws increase, we can remove them later on if need be. But you're going to have like 2 and 4, so I don't think it's going to cause any problem.
Okay.
But do remember, as age advances, these things take longer time to heal.
Yeah.
So for a younger individual, we say 1 week here and 3-4 weeks.
Yeah.
That you have to double it when
Yes.
you're above 50.
Yes.
And so that's one thing you have to be careful. And because you're on hypothyroid medicines, then of course, ECG, echo, all the anesthesia clearance is there a little bit.
Yeah.
We'll have to just get that done. That might take a few hours.
Yes. Yeah. That's fine.
So I'm just going to do these procedures now for confirm thing. You let me know about the eye plus or minus the dimple later on. That's all right?
I also will do later.
Yes. Because eye is also local anesthesia.
Okay.
It's better under local anesthesia than you want me to do with eye under GA. I can, if you want to. What happens is GA, local anesthesia means you can see immediately. General anesthesia you won't be able to see. This I cannot do under local anesthesia. Okay, this I can. It's not going to be a big procedure. 2 or 3 small injections and we can do it. How comfortable are you in you're not comfortable in local anesthesia?
No, not that way. Like I'm thinking like.
Why another pain
not
after
like
that?
Do it in one go.
Okay, got me. We'll do that. And only lower eyelid, right?
Yes, just the lower.
So the dimple you let me know later on.
Yeah.
He's come? All right. So we have to get her. You have any more questions, madam, for me?
So, post the surgery there will be liquid diet. So liquid
Yes.
is just water?
No, anything liquid. Lassi, juice,
Oh, okay.
anything liquid.
Okay. Right.
That will be there for a while for you on diet.
Yeah.
Because we're pretty much going to be working all across everywhere, so all inside the mouth.
Yeah. And then, so, like for how long would I have to stay here?
5 days,
Okay.
4 to 5 days at least,
Okay.
post surgery,
Yeah.
and hang around in our town for maybe 7 to 10 days.
Okay. Yeah.
By the time everything will be done.
Yeah.
These sutures we remove usually on day 6,
Okay.
and the rest sutures are not going to come outside, all inside.
So will they be visible?
For maybe couple of months, small line will be visible. Eventually, it's not visible.
Okay. But I should be able to hide it with the makeup. Because I don't want to discuss all my personal things with my.
But what type of work are you doing now?
No, I'm in IT, so but only once in a month we need to go.
Definitely people will know something has happened to your face.
No,
Not under the eye,
that
but
is okay. That
people will ask you, you can't lie.
I'll come up
This
with
is
some
something you
story.
can't hide.
But if there's some scars or something, then immediately, what happened there?
No, they will notice not the scar, they will notice a change in your facial form.
Okay.
Yeah, a lot.
Yeah.
That's one of the reasons I want to record the video also, because see, how do I say, we might do same procedure for two people, okay, but for some, based on the anatomy, based on how it looks, the result becomes like wow, or like it's dramatic.
Yes.
And for some, we might do the same thing, but the result is not going to be like, it'll be improvement,
Yeah.
but subtle.
Yes.
In your case, it will not be subtle, it will be like a marked improvement, significant
I
improvement.
want to see that actually. But
Yeah, and that we want to record that too. So people don't know. Believe me, many people see. I mean, even you, for example, you've been like 5 years of life, right? 5 decades, and I'm not sure how many people have suggested this kind of procedure. Here, locally, no one does. People don't know about the facial balances, about the proportions. So that actually makes a most important effect to the facial aesthetics, more than just doing fillers or Botox or just getting rid of the grooves and the creases.
Yeah.
No, I'm just trying to tell you the logic.
Yes.
So the first thing in facial aesthetics is function. The second thing is symmetry, and the third thing is proportion.
Yeah.
So always, if these are the three pillars I consider for facial aesthetics. And if you look at literature, it doesn't give it like, they don't give it like that. That's why people are doing skin tightening, they're doing many procedures. That's why I think the acne is very insignificant in my treatment plan for you.
No, to be honest with you, I've had like quite deep scars for a long time.
But your acne scars are pretty good now.
Yes.
I don't think
So
we can't improve them.
I use all these like retinol and things
Yes.
like that, and that is
You carry on with them, they're doing good for you.
Right.
I think that you can continue the way it is, and then we'll do what we.
Yeah.
Alright?
So what is the healing? How long is the total healing process?
So 1 month at least. It'll take a while.
Okay.
So even if you leave from here after 10 days,
Yeah, it'll still take a while for it to heal. If you have any other Indian address, you can hang around, or you can just stay in a resort here, chill some time, so that it's safer than. See what happens if you go back directly to your parent country, and then even if you have to go to a doctor for a simple issue, the hassles are more, they'll ask for scans, they'll do a lot of circus, especially in Australia, UK, US and all. So it's better to just be here for one more week in the holiday. In case something happens, it's just a 20-minute drive, and we fix it in a minute or two sometimes. As simple as that.
So actually we are considering going to Trichure on 19th or 20th.
Cool.
And
That's a
we'll
long
be there,
time.
say up to 24th.
Okay.
And then on 24th we go to Mumbai, and then from Mumbai we return to Sydney. Does that sound okay?
That sounds okay, because you're still in India till 24th, right?
Yeah, like in Kerala up to 24th, and then we go to Mumbai on 24th or 25th.
And then how long in Mumbai?
3-4 days and 29th.
Okay, cool. So India is easy, any place.
Yeah.
For troubleshooting, any dog, they'll not do such crazy things.
Yeah.
So
Okay.
it's fine.
And what sort of trouble might occur?
Two most common problems that can happen is bleeding, either because of a small trauma or because of some delay in healing.
Yeah.
And second is infection.
Right.
Very rare these both are, but still these are the most common things.
Okay.
For example, 1 in 200 patients, especially because you're traveling, right? See, as long as that's why we keep you for 7 days, 5 days, and all that. If you're a local patient, we'll send you off after day 3.
Yeah.
So that you have to take care. And second reason is it's done inside the mouth. So if it's a rhinoplasty, infection is lesser.
Yeah.
But inside the mouth, what happens, have to be careful.
So how about brushing and stuff?
You have to,
Like, can
we'll
we
ask you
do
to
the
brush. You have to
brushing
brush.
like normal?
Yes, you'll have to brush still.
Okay. Right.
But because of gravity, the food tends to come down everywhere. And you won't be able to move your cheeks and muscles and all that.
Yeah.
So the self-cleansing mechanism after these surgeries is not very effective. Hence, you have to be extra careful.
Yeah.
That's the thing, you have to be careful. That's why I say, the sutures are usually dissolving in 1 month. 10 days is a period when the mucosa heals. 7 days, 6 days the skin heals. 8, 9 days the mucosa heals. Once the outer layer heals, then it can't, your fluid or saliva or food cannot get inside, and therefore there's no chance of infection.
Right.
That's why we say these things, that's all.
And also, there are those plates and
Yes.
screws. And would you be giving some sort of letter or something like that? Because in the metal detector,
No, these things usually don't cause an issue, but you will get a discharge summary with you anyways. We will take your scan before and after, everything will be there with you.
Okay.
They won't create a problem, they know this.
Okay.
2 decades back, people used to have issues. Nowadays, no.
Okay.
They know these things are very commonly
Because
done.
one colleague of mine, he did hip replacement, and they sort of fitted him with
Yeah.
the metal thing. So he's given a card, and every time he passes by in
Correct.
the domestic airport, he has to show the
That
card.
because they wonder what it is. But even that they can see nowadays on the scans.
Okay.
Very rarely you'll have a problem with your case. When we use a lot of implants, some of them have issues. But you have to keep that discharge summary or anything with you, that's all. Just tell them that I had this procedure.
Right. Okay.
They won't create a problem.
And then, would there be any difficulty in speaking post-surgery?
Initially, yes, for a few days,
Okay.
because the musculature will be in a different position, pain will be there, all of that. But eventually you'll be as comfortable as you are right now. No change will happen with your speech whatsoever.
So say after 2 weeks or so, can I go back to my normal work and like talk
Talking?
on the phone and stuff?
Maybe no. Maybe go a little bit slower than that. But that first day itself you can talk.
Yeah.
Matlab you can talk to anybody a little bit, but you can't go for a meeting, for example.
Yeah.
That level of talking you shouldn't do. Or you shouldn't talk to someone for half an hour. Also, if you keep talking initially, you see everything moves.
Yeah.
So if you move it less, it heals faster.
Okay.
And that's why orthopedics, they put this, that's why when we put plasters and all.
Yes.
Because when it doesn't move, right, it heals faster. Because you're working on the bone
Yeah.
primarily. And the soft tissue drapes on the bone. So if you keep on moving it, that's why we ask you not to move much.
And you mentioned improvement on the lips. What would that be?
So your lower lip is thick now, and it's also everted. So that's going to go back inwards and probably get thinner.
Okay. But
And little bit downturning is there. That also gets corrected for a lot of patients.
so my thinking is that my upper lip is like very thin, like quite thin, and also uneven.
So upper lip is not thin because of age. The upper lip has become a little less elastic. But that, if you want to address, you can do a lip lift or something later on.
Okay.
But now what happens? These muscles are going like this. Okay. Then there's a mentalis from here. There's other digastric, other muscles. Your buccinator. When I work, the whole what shall I say? The muscle group itself will move.
Okay.
Because they're all attached to the bone eventually.
Yeah.
That's why I'm suggesting not to do the dimple also at that time. Because the dimple is created in an area where there are already 5-6 muscles. And now we're already going to move. So that's for
Okay.
better not to. That's why there'll be changes in the lip shape.
And would the skin look a little bit tighter?
100%.
after surgery?
Yes, absolutely.
Okay.
That's why I said reverse facelift effect will have. Very much tighter it will become. Much improved. Here will get tighter. Distance from here to here will be better. Jawline will get defined. Many things will happen.
I'm sort of
Jawnoplasty and jaw sculpting. We're going to show you how this patient looked just before we started. You can see that improvement. Okay, now we're going to show you the front view. Once again, you can appreciate the improvement. So the lower third was very, very short, and the lower third was very, very square. And this patient was in a 5th decade of life. So there was jowling, there was loose tissue. So we've corrected all of that by means of this bony procedure around the chin and the lower bottom of the mandible, which I call it genioplasty, jaw sculpting, angle osteoplasty. So we've made the jawline more defined, we've made it more proportional, we've augmented the chin, we've got the angle going, and we've tightened the skin, as you can see. I'm going to show you the same view. Tell you how we have done that on the scan. Everything is in good, perfect position, everything.
Okay.
Wow, it's peeling off so easy. This is like the easiest in months now. That's awesome. Perfect. All right. Okay, sit down like this. Okay, pakan look on. Ma'am, there you go. The front view.
Such a huge difference.
Yes, ma'am. And it's going to get even better. Like I said, it's going to be a wow result for you in the consultation itself. You remember? So now you can see the proportions have improved significantly. Look at the shape of the lower lip. Look at the shape of the two lips. Even the lip shape will improve. Even upper lip a little bit. Lower lip dramatically. And in the shape, you see that the jowl is not. And this is all, still a lot of swelling.
Yes.
It'll go in like a lot, like at least 5-6 millimeters. Okay, then we'll move on to the other view. Look at this view now. And if you see here, turn out a little bit, ma'am. Yeah, now you can see that. Hold this. And see this angle also is gone. The position, of course, is there, but the jawline has become more defined,
Yes.
And this thing, this area is all straight. And this side also. Look at that difference. Yeah, this side is even better than the other side. Because, ma'am, that side there was some fluid. Remember in the morning I was pressing out some fluid. So there's a little bit more swelling on that side than this side at the moment. So you're getting more definition here straight away. But look at that. Look, I mean, it's changed everything, the whole facial thing. And even the eye, of course, that's a few millimeters, but even that's...
No, I'm very happy. I'm already very happy.
Thank you. I think your husband will be more happy also because he was so fearful. I asked him, but now you can appreciate the thing once we remove the plaster and wait for 4-5 months. I'm telling you, it'll be even better.
Okay.
And this takes time because, I show you now on the scan where we have done the surgery on the bone and how I've contoured it and moved it forward and everything. So it takes longer for the bone to heal.
Okay.
So once the bone heals, the muscles have to attach. So the masseter and other muscles.
Why are you crying?
Oh God, that's so sweet. No. God bless you. Come, madam, you come here. I'll explain to you what has happened and all. So this was a scan we took on the 7th.
Yes.
And this is what we've taken today, 1 week later. So I'm going to show you one by one. So the front view, if you see in one look, you can see that this is in a funny angle, right? So because only by keeping in this angle, I would get the straightness. That's why this is a little bit of not medicine alone. Because the angulation, you move this, what position you keep, that depends on aesthetics, and there is no medical guide to do that. Cutting, we have medical guide, avoiding the things there. But how to keep it, where to keep it is your thing. All right. So that's where I've done that. And now I'll tell you some more things one by one. So if you see this side view, you see this was like this.
Yes.
And now you see almost like that. Then this will get filled up a little bit. And then, I've tried to make it like an angular one from the side view. So what you have to be careful is this chin should not get hit here. Because it's now forward and down like this, hanging on 4 screws with a huge gap in between. This is probably 14 mm or something. I can measure it. I'll tell you, I think it was around that. I'll show you the measurements now. So we'll move on to another view for measuring. think this is also going to be such a. Okay, before I say that, you see there is something hazy here.
Yes.
If there is soft tissue, it will be like this, dark. A bone will be white. This is hazy. Why? Because I put some bone graft there.
Okay.
So what I did was I've harvested some bone from this part of your mandible that was excess and that was like a square. So when you want to correct a 90 degrees and make it more angle, so I have to take out some bone to get the angle. So that bone I have used to fill this gap in between.
Okay.
With PRF2. That's why you see it like this. It's useful for people in their 5th decade and all. Youngsters, no need. Body heals like fast by depositing bone. But I've seen as you age, these things help because then it's easier to heal for the body. So that's why that small things. The distance, I'll show you the distance between the two ends. So this is the distance between, this bone was there. Can you see that?
Yes.
Now this that was here, not only, you see there's looks like it's floating. Because of the structure of the design of my osteotomy, I've got it touching on the back.
Okay.
And I've arced it forwards and downwards and put graft in between for stabilization and for faster healing. And this is the distance that you see today, 13 mm. But if I take another cut, it might be 14 also. It was 14 clinically, but 13, 14 it will be there. There might be 1 or 2 mm of relapse also. Okay. Eventually as it heals, it will go back a little bit. Anyway, you will get it. Now, the important thing, do not keep anyone on your lap, because if they hit even a little bit like this, so because it's in that position, it can move.
Okay.
So 4 weeks, you will be very, very careful.
Okay.
Now, if you get a slight side hit, it's not so much for you a problem because of the design of it. But down, no.
Okay.
I'll immediately topple.
Yeah.
Then we'll have to do another opening, fixing and all that stuff. So be very careful with that. Any thing from down. Okay, that's the first thing for you. And after 4 weeks, or you can wait 6 weeks, all of this will heal. Once it heals, then you can have a normal this thing, no problem whatsoever. Okay, I'll show you the angle part. So if you see here, these angles have stopped, it's gone. And also if you see the thickness of the bone has become a little thin there. And the nerve is here, and this is all the tooth root structure. That's it. This is just that part that you have to be careful about. And there was a little collection inside which I drained in the morning. That was not blood, that's just saliva or other things just dribbling in, and some serous fluid that comes inside also.
Okay.
So what you have to do is, we'll give you a gel which you'll apply inside. Have they already given you that?
Green tube.
Yeah, it will be like a gel, just put inside daily 2 times. Do not rinse your mouth, do not increase the pressure inside your mouth.
Okay.
Because if you rinse, it will go down. Okay. This is for another 1 week. They will give you antibiotics for 1 more week of 5 days. Take that antibiotics.
No more injection required?
I think we can stop with injections. Yeah. It's just good. Hello. How much, doctor?
Okay. And now, so what about eating? Like, can I have like kanji rice
Yeah.
and all that from tonight?
Kanji rice is fine.
Like, whatever I can gulp?
Yes.
No chewing?
You can gently, like just open your mouth and close.
Because
The only concern is,
properly.
you can brush also. The problem is not the brushing, it's just beneath that. This is all gravity related, right? So if you chew a lot, everything moves also. So you would want these things not to move also much.
Yeah.
That's why we say liquid diet, and also that you don't move it much.
Yes. Yeah.
Because if you bite here, this muscle will pop out.
Yes.
It will not pop out for you now.
Yeah.
So I've operated even there. So the muscle takes 3-4 weeks to get back attached onto the bone.
Okay.
So that's why you should take rest in terms of diet and all that. Talking also, do less talking.
Okay. Alright. And now, when can I go back to like doing gym and stuff? No?
1.5 weeks. 1.5 months.
By August.
Yeah,
Ideal.
August is fine.
Ideally.
August surely.
Okay.
August first week is okay.
Otherwise, I can do like normal walking.
Not exertion, gentle.
No,
You should not exert.
Yeah, okay, just now.
For 10 days, 15 days, don't exert, because if you exert, can bleed
Oh, okay.
or some. Don't do that. Nothing will happen if you don't exercise for 2 weeks. But you can be on diet. See, another thing why I say patients not to exercise is surgery is a stressful thing for the body. Already we have cut the bone and blood has been lost little bit. Body is healing. You need more nutrients, right?
Yes.
And you're not eating also properly. We have put you on diet. With these both coupled, if you go to exercise, it's not good. No need.
Can I go back on my iron tablets and all that? Which
Yeah. You have to go back on everything.
Okay. Yeah.
All tablets, everything else, please go back.
Okay. Now, with regards to this one, how will this heal?
So, it takes a while. They remove the sutures for you, right?
They removed from here.
They did
This
not
one,
remove.
not all of them.
So the first step is to sutures have to go. After the sutures go, then it will just heal automatically. Nothing has to be done. After 6 weeks, you should not see any scar. The left side is bruised a little bit more. I think it will take maybe a few days more to heal.
Yeah. Okay.
But this is only soft tissue, so
Yeah.
not as much care needed as compared to this.
Okay. So, do we have to come here again?
No.
For this?
No.
suture?
You leaving when, tomorrow?
No. We are leaving on 18th.
Lot of time is there. Then come over.
Okay.
Come tomorrow or
We
day
have to
after.
come on 16th anyway for him.
But this we should do it on day 6.
Yeah. So today is day 5.
Day 6 is better. You should not get a scar.
Okay. So maybe we are.
tomorrow.
No. We are coming on 16th.
Day after?
For
Okay, come day after.
doctor.
Okay.
Come day after. Take it out.
Yeah.
Those are very fine stitches and those are dissolvable also we've used. So it's not going to cause a scar. Just saying.
Okay.
Yeah.
Generally removed on day 5 or day 6.
Yes. Okay.
So after that we don't have to come back because we are
No.
7 days and then
No.
we are off. Yeah.
No.
I had one thing that I forgot to discuss with you.
Tell me.
When I first came. I have this, I was like really minor. Now I don't know.
She told me this.
But
So when we were after
Yes.
intubation, she told me. But I was like, I haven't discussed with you in the consultation. I don't want to do. Because patients then get upset. I don't know correctly what you have told me and then what you have told her.
Yes.
So based on that, I said I'm not going to operate.
No, but what would be the best way? So like when I put bindi, I always have to put it on one side because it never sticks there. And I don't know when I got it. Maybe in my childhood or what, I don't know.
But what exactly do you want to do? What is your
I
concern?
don't want that. It's like a hump there.
Small.
Yeah.
Huh.
And
You want that to be removed, is it?
yeah. So one concern of mine is, will it give a scar? If there's a scar going to be, I don't want to be.
No, not that will give a scar, but nothing is there actually.
Because what happens, no, when I
Very
wear
small
Indian
bump
clothes,
is there.
always I have to put bindi on one side and it looks really funny.
Because that is, but that is not in the midline. That's already little bit towards your left.
Exactly. So if I put a bindi here, it doesn't stick here. So it moves.
But why doesn't it stick?
It moves around and it sort of. Yeah, seriously.
Why would it not stick?
doesn't, and then it looks a bit uneven. So like it doesn't look so good.
I don't believe this bindi not sticking.
Yeah, seriously, it doesn't look good.
That may be. That if you say, I won't argue. But if it doesn't stick, I don't know. I think it should stick. So okay, what do you want me to do? That small bump you want me to remove? I can remove that. It's not a big deal.
And it won't leave a scar. I'll be very
It will be
happy.
better than now.
Okay, I'll be very happy if it.
Because that's already a scar only that's caused it.
I don't know when it
Yeah,
happened.
that's a scar.
Because
The scar, you can see a small line on the scar, right? It's a line like this small scar. And one end of the scar, we call it dog's ear. That is, it's not sutured precisely or some raised edges there. That is what you feel like a small bump or a hump or whatever. Yeah.
So if it could be removed, that would be really nice. I mean, we can do it on 16th, like no rush to do it.
No, but 16th also will be hard, I think.
Okay.
Again, we'll have to put this IV line, all the drama
All of
starts,
that will
right?
happen, is it?
Yeah,
thought
I have
it
to-
would
I
be
need
just something and like sort it
Minor,
out.
but I'd still need good lights and sterility, and it's fine, right?
Yeah.
So I need my good instruments to sit there and do.
Yes.
If I done with this, it would have taken me 10-15 minutes, but now. If you have not,
think and let me know if it's possible.
if you don't want to do, I'm happy.
I actually wanted to get the dimple done, seriously. Like,
Dimple, see, I told you the reason. Because so much has been done, work, it's better to wait. Because I'll tell you what has happened. Now the width of the face will come down. So if I plan my dimple here, normally dimple is planned on the pupil line and this line going here. Sometimes when you do it, this will move a little bit after the whole thing comes. So why take a risk?
No, I got it.
That's why I said don't do it now.
Yeah, I got that.
If I had not done such an extensive thing, we would say okay, get it done.
Yes.
And dimple and all, it's not a very
No, just a desire really.
correct.
It's
No. Not like that. It's also somebody else can do that for you without a big thing. But these things are hard.
Yes.
So I try to, because you've come traveling miles and miles, right? I rather do things that are special or more beneficial for you
Yes.
than something chumma to do here and there things.
Yeah.
That's the reason I said no, all that. And now for this, it's a simple, again, procedure. So maybe we will leave it. Maybe it's a reason for you to come back again.
It took us like 32 hours door to door.
Chumma, you'll come to India anyways, right?
Yeah, but
And he's from Kerala. So anyway, you will come. We are not far from Kerala. Chumma, I'm saying. If you really want to do it, we'll do something on 16th. But
okay, have a think about it. If possible, we'll do it.
okay.
If possible. If not, then that's okay. I can live without it.
Yeah, so let's see on 16th how the schedule is like.
Yeah.
If I'm not crazy busy or something, we will do it off.
Okay. No worries.
Maybe
It
you
would be
stay
nice.
here more.
No. This is just
No, this is minor thing. This is.
no stay. You just get couple of stitches and you leave.
Yeah.
It's a very small one procedure.
Yeah.
But remind me on 16th. They ready on top? Okay. Then we have some time.
So 17th, so our plan is basically 17th go to Kanyakumari and then we will go to Trivandrum on 17th night and then 18th we will go to his house in Trichy.
Cool. Everywhere she has to be careful while traveling, not all these precautions you take.
So we can drive from Trivandrum to Trichy. Is that okay?
He's gonna drive, right? Or you're gonna drive a taxi?
we will
Somebody
drive.
drive.
Yeah, someone
That's
is
okay.
driving. So,
Not a
like
good
my
idea
road
to
is
go
okay.
so far to Thrissur. It's not like it's a horrible journey. Why would you want to go by car? I don't recommend it for any person.
Because our luggage is quite a lot and we are not getting any flights.
Go by train.
Train is like
No, it's better for you. Roads are very bad. Thrissur will take many hours.
Yeah,
Or you will start here at 3 o'clock in the morning, then you'll reach at 8:15, 8:30 there. If you start here at 10 o'clock, you'll reach by night. Bad roads. I go to Cochin and also I know.
Okay.
And I used to go to Thrissur quite often before. I did my first training in Thrissur. There was a very famous elderly surgeon by name Dr. Edenwala in Jubilee Mission Hospital. He's no more now. He just passed away recently in his 90s. But 99 and 2000 I was there. Very nice hospital. But then from here also I go to Cochin more often than Thrissur. It's very difficult. I don't recommend road journey. I go by road journey because I don't have any other option sometimes. Otherwise, train is 100 times better.
because like we were thinking like once you put luggage in the car, then we can just go.
Go to the railway station, porters are there. 400 rupees, he will take your luggage and give it wherever you want. They have a trolley also. Book a nice AC 2-tier sleeper and go, it's comfortable for you.
Okay.
10, no, 100 times more comfortable.
Okay.
If you, for example, want to go to Madurai, or let's say you want to go to Dindigul, or you want to go to Salem also, which is like double the distance from Thrissur, but in Tamil Nadu you can go by road. Roads are fabulous. There you can't go. There are no winding roads and there's no express. There's no 4-lane road.
Because his house is in a place near Trichy, like
Everywhere Kerala train will be there.
up to Ammadam, do you have trains?
It's very close by.
That will not be a problem. For him also road journey is not a big issue. For you, see, it'll keep on. He'll swerve, he'll go here, he'll go here.
Yeah.
Why? Take a chance. And it's not comfortable also.
Yeah. Okay.
If you can book a train from here to Thrissur, you will find it.
Okay.
If that will be the best way to go.
Yeah.
There are no proper flights also.
Okay.
Simply have to go to Cochin from Trivandrum.
Yes.
Not worth the headache.
Yes. Yeah. Okay.
All right.
Okay.
See you.
See you on
I see you on the 16th then.
Yes.
Hey, 16th is what, day after? I'm not there on the 16th.
Okay.
That's why she was showing me some eyes. I was like, what is she trying to say?
So
I'm
if you
not
come
there
on
on the
17th, then
16th.
we can go to Kanyakumari on 16th. And then we have to
16th, I'm in Bangalore. One day I have to go there to Bangalore. 17th, I'm there, yeah.
17th. Then we have to also inform the.
But his
other doctor.
sutures, this suture, they will do it. Only this, no, they won't do.
So we can do both together.
On 17th? Okay, come on 17th.
that's
If
okay.
you're that keen, we'll do for you.
Yeah. Because seriously, like it's not easy to plan nowadays to travel with this COVID and whatnot, and Australia closes the borders in no time.
Yeah, Australia is very good at all these stupid things.
Yeah.
They even know a lot of tennis players.
Yeah. Let alone tennis players. Like even if you're across, if your town is like, say Nagercoil, Trivandrum, you cannot go from Nagercoil
Correct.
to Trivandrum.
I know, my some family lived there, they create a lot of problems.
Yeah, so that is why
Then come on 17th.
if that's okay. Then we have to inform the other doctor because
We'll finish mine. We'll come here again on 17th for you. It's fine.
then we won't be able to go to Kanyakumari.
It's okay. We'll check it out. Check it out.
Because he was actually saying that he will come on 17th. Then we said to him like, no, can you please come on 16th because that's what the.
He can come on 17th. There's no work for you. You come on 17th. He doesn't come also, no problem.
You just have to change the bandage.
She'll do it. Don't worry about all that. Nothing is there major for him.
Okay.
Yeah.
You can come on 17th. You come around on 17th.
Okay.
She'll manage that. Only dressing and some stitches have to be removed. Nothing is there other than that. Everything is fine.
Yeah.
So come on 17th. She has all the medications, right, that you will be taking when you leave today or tomorrow?
Yes.
Are they leaving today?
Today they are getting discharged.
So then all the medications you take, both of you, whatever has been given, no? Don't
So we
skip it.
start from whatever is like from night.
Yeah.
Huh.
So there are, for few in the
ठीक है.
morning, few in the afternoon. So we start from there. Yeah.
Done.
So